Patients come in through various avenues to be seen here at California Fertility Partners. Sometimes they're referred by their obstetrician gynecologist after they've been treated for a while for their fertility issues. Sometimes they come in because they've been referred by one of their friends who was seen here. All patients, as they come into our system, no matter which doctor they're going to see, need to have their previous treatment records forwarded into us. We all want to look at what's been done with that couple, that patient, before we meet them for the first time, because it's very important to know what their history is. If they've had certain tests done, certain treatments done, we don't want to go back and redo those things. So that information when they come in is very important. We take time and look at those records before we sit down with the couple for their first visit.
And at that initial consultation, we describe what we've learned so far about them. We inquire about their needs, their goals, what kind of treatment might be acceptable, what kind of treatment might not be. We outline, following an examination and a pelvic ultrasound, we outline a plan, including some testing.
The tests that we use to try to identify problems with a couple's fertility are very few and basic. We ask the woman to follow an ovulation testing program. These are little home tests that the woman can do to determine when her ovulatory time is. It's a little urine test. She does it on a day-to-day basis. When it turns positive, that signals that she's going to be ovulating in the next 24 to 36 hours. We want her then to come into the office for a visit the next day. And what we're going to do is do an ultrasound to look at whether she is actually in a pre-ovulatory state by the ovarian follicle development. And we're going to look at the uterine lining development to see that the synchronization of her hormonal changes has brought her timing of her egg release and the uterine environment into a synchronization. While she's doing that, we're going to have her husband during this time bring us a sample of sperm in, and we're going to do a semen analysis. The semen analysis checks three major components. We want to know how many sperm are being produced in the ejaculate. We want to know how many of those sperm are moving or having progressive motility. And we want to know what percentage of those sperm have normal shapes.
Within a day or two of the results of those tests, the patients are called by telephone or contacted by email. The results are explained, and a solid plan is put in place.
We also have to be cognizant of the fact that all of these issues are very emotional. Being infertile is a very emotional issue for a couple. So we spend some time in trying to reassure them that they're not alone and go through some of the things that they're going to feel during treatment. And we want to try to help them through that process.
Let's consider age as a factor. Not just the age of the wife, we think about that a lot, but also the age of the husband. Men may not admit it, but we fade also. And so it's important to gear that evaluation based on the individual couple in front of us. What are their unique characteristics?
The doctors here at the California Fertility Partners have always been of a mindset that we need to be in contact with our patients. And that's why every time a patient comes in for an ultrasound or an insemination or a visit, she's going to see her doctor. We don't use technicians. We do our own work. We do our own inseminations, our own ultrasounds, because that's the time that we can converse and answer questions and go over problems on a day-to-day basis. Every time she walks in for a visit, whatever it is, she's going to see her doctor. And I think by doing that, we not only can educate the patient to the process she's going through and make her feel less stressed and more comfortable, but it's the contact and the conversation to deal with these issues that may not come up with the nurse or anybody else. So we think it's important to have that contact, direct patient-physician contact every day.